Imagine this. You're sitting in a hospital waiting room, worry creasing your forehead as you wait for news about a loved one in surgery. You know their doctor is skilled, but you've also heard about rare complications during the procedure. Now, the doctor enters, their face serious. They explain the situation honestly and ask you to consider a solution, a blood transfusion. They assure you it could save their life. But you shake your head, unable to give consent. Your religion forbids it. So you watch and wait as the doctor makes a tough choice, knowing they might lose a patient they worked hard to save. This is not a made-up scenario. Thousands of hospitals face this annually, dealing with patients like Jehovah's Witnesses who refuse blood transfusions. But that's just one piece of this faith story. Join me as we delve into their central tenets, challenges, and triumphs. We'll explore their unwavering commitment to Bible study, their door-to-door ministry, and their tight-knit community. But we'll also confront the harsh realities they face, from shunning medical interventions to enduring social stigma and even government persecution. This is more than just a look at their practices. It's an invitation to step into their shoes, showing you how daily life unfolds for millions worldwide. Jehovah's Witnesses are recognized for their door-to-door ministry, their focus on Bible reading, and a few deeply held convictions that set them apart. One of the most discussed is their refusal of blood transfusions. To many people, that choice feels extreme. Why would anyone say no to something that in a doctor's view might save a life? For Witnesses, the answer is not stubbornness or a distrust of medicine. It is a matter of conscience before God, shaped by how they read the Bible and how they view life itself. To understand their position, start with how they see blood. For most of us, blood is a medical resource, a fluid doctors can replace if we lose too much. For Jehovah's Witnesses, blood is more than a bodily fluid. It is sacred because the Bible ties it directly to life, and life belongs to God. This conviction begins early in Scripture. After the flood, God spoke to Noah and his family, the ancestors of all people, and gave a command that witnesses see as universal. Only you shall not eat flesh with its life, that is, its blood. Genesis 9-4. Because that instruction was given long before the law of Moses and long before the nation of Israel existed, they believe it still applies to everyone today. Later, in the law given through Moses, the command becomes even more direct and solemn. I will set my face against any person who eats blood, for the life of the flesh is in the blood. Leviticus 17:10-14. Deuteronomy repeats the point and adds a reason that speaks to the heart of their belief. You shall not eat the blood. You shall pour it out on the earth like water. Deuteronomy 12:23-24. In other words, blood is not to be used as ordinary food or common property. It must be treated with respect because it represents life, and life belongs to God. Jehovah's Witnesses read these verses and conclude that blood is sacred, and God has never treated it as something casual. Someone might say, but those are Old Testament laws. Christians aren't under Mosaic law. Jehovah's Witnesses agree that Christians are not under the Mosaic law. However, they point to what happened in the first century when the apostles met in Jerusalem to give guidance to non-Jewish believers. In that council's letter, the instruction to Christians was short but firm. Abstain from things polluted by idols, from sexual immorality, from what has been strangled, and from blood. Acts 15-20, 28-29. See also Acts 21-25. For Witnesses, that single word, abstain, carries weight. To abstain is to keep away completely. They reason that if God asks Christians to avoid blood, then any deliberate taking in of blood is off limits. And because the letter mentions both things, strangled and blood, they believe it is not merely a ritual rule, but a clear, practical command about how blood is to be treated by God's people. But transfusions aren't eating, others reply. That is true. Blood transfusions did not exist in Bible times, so you won't find a verse that mentions them by name. Jehovah's Witnesses apply the principle rather than search for a direct label. To them, the route into the body, mouth, or vein doesn't change the moral issue. The apostles didn't say, "Don't drink blood." They said, "Abstain from blood." In witness thinking, abstaining means not taking it into the body at all as a way to sustain life. If God's law prohibits using blood as nourishment, they argue, then receiving it intravenously as a life-sustaining substance violates the same principle. For them, it's not a medical technicality, it's a spiritual boundary. This is why, even in emergencies, they refuse transfusions. It isn't because they value life less, quite the opposite. They see life as God's gift, and they believe God has the right to set the terms for how life is protected. If the Bible teaches that blood is sacred and must not be used to sustain human life, then they accept that boundary and put loyalty to God above immediate survival. They also hold to Jesus' promise of resurrection and everlasting life, John 5:28-29, which gives them courage in moments where others might make a different choice. In their view, it is better to obey God and trust Him with the outcome than to break a clear command for the sake of a few more years. That doesn't mean they reject medicine. In fact, Jehovah's Witnesses actively seek high-quality medical care. They consent to surgery, anesthesia, antibiotics, and advanced therapies. Their objection is specific. They refuse whole blood and its 4 primary components: red cells, white cells, platelets, and plasma. They also do not donate and store their own blood for later use, because they see pre-storage as taking blood out of its God-assigned place. Where there is room, they make personal decisions. Many will accept certain fractions derived from blood, such as albumin, immunoglobulins, or clotting factors, because they view those as components rather than the primary parts of blood. Others may choose to refuse those two as a matter of conscience. They also decide case by case on techniques like intraoperative cell salvage when the blood remains in a continuous circuit with the body. Because of their stance, witnesses have encouraged the growth of bloodless medicine, a field that now benefits many patients, not just those who share their faith. Doctors can use medications that stimulate the body to produce more red cells, like erythropoietin, intravenous iron to build hemoglobin, drugs that help blood clot, such as tranexamic acid, and meticulous surgical methods that reduce blood loss. They can use volume expanders, fluids that maintain blood pressure and circulation while the body heals. Some hospitals have entire programs dedicated to managing patients without donor blood. Many surgeons report that these strategies not only honor patient beliefs, but also reduce certain risks associated with transfusions. In that sense, a religious conviction has pushed forward practical improvements in medical care. Still, the choice can be hard. There are legal questions, ethical debates, and emotional moments in hospital rooms. Critics sometimes say the teaching endangers lives, especially for children. Jehovah's Witnesses respond that they work with physicians early, carry medical directive cards, and make sure their wishes are clear. Parents and medical teams often find acceptable alternatives together. In rare conflicts, courts may step in. Even then, witnesses stress that their goal is not to defy doctors, but to honor God within the bounds of the law, while seeking the best bloodless treatment available. On the ground, many doctors and witness families build respectful partnerships, focusing on solutions rather than arguments. It is also fair to ask, is this really what the Bible meant? Sincere Christians disagree. Some say Acts 15 was about table fellowship between Jewish and Gentile believers, not medical ethics. Jehovah's Witnesses hear that and return to the wording, abstain from blood. They note that the letter included sexual immorality, moral command, not a ceremonial one, and believe blood belongs in that same category of ongoing Christian obligation. Others say eating is not the same as transfusing. Witnesses answer that the method of intake doesn't erase the principle.